What's up, Doc Mike? Today's topic for March 1, 2021. We stand with public health testimonials. Thank you, Johns Hopkins Bloomberg School of Public Health.
One of the things that I've experienced, and I know some of my fellow health commissioners around the nation have experienced, is, harassment and complaints from the public about some of the public health orders that have put in place. At times it got to be, somewhat personal, some of the emails I received, especially knowing that I was following the science and I was following the guidance, and the case count in our community was extremely high. Our hospital volume was at a very critical level. So I was really following the science, but it's been an awakening to see how many people are really concerned about their own health or their own well-being and their own lifestyle, and not really taking into consideration those in their community and those who are around them. The first challenge that I faced that was really tough as an African-American woman was the call we heard from the community when testing was limited. What we were told by our hard to reach population, which includes our minority population, was testing wasn't accessible. I felt a sense of responsibility to meet the needs of the community. And I was fortunate that I was able to get my hospital partners to step up and provide testing here at the health department for those individuals who didn't have a doctor, who didn't have a healthcare provider, so they could come here regardless of their zip code, regardless of their income, regardless of health insurance, they could come and get tested. I have a phenomenal staff, and I really could not do the work that I'm doing, that we're doing, without some great dedicated staff. But people are exhausted. People are tired. People want to go back to their old job. Now they're working a vaccine clinic, or they're working a call center, or they're doing case investigation. And they want to go back to their previous jobs. And for the most part, that's just not an option right now, because our number one priority is getting our community vaccinated, followed by doing case investigation. I'm constantly trying to figure out how to motivate my staff, how to encourage my staff, how to get them to take some time off for themselves when they can. But it's not just the work that everyone's dealing with, but there also are issues at home. There are a lot of stressors that we all have, but yet for our industry, we've had to continue to move forward. So it's hard, and it's hard for me too. I had a few times in the last 11 months where I just got drained, and to the point that I almost made myself sick, and I had to heed my own advice and, take some time for myself as well. But it's hard because you don't want to miss a beat. You don't want to miss the opportunity to make an important decision. And so you keep powering through, even though you need to take a day off and rest some.
It's been a very challenging year for so many different reasons. Obviously, other aspects of public health don't go away when a pandemic hits. We have the issues of the pandemic and the challenges that have gone on through there, and getting out the information and the science to the public to make informed decisions, and also to our politicians to make informed decisions. Some of the rhetoric and vitriol that's been out there has made it difficult to get a clear and clean message out to folks. Science got messed into politics, and we got comments about being flip-flopping and that you're changing your viewpoints. And it's not a matter of changing viewpoints, it's a matter of using the science of what we have at this time and making an informed decision. We've had health officers who have quit. We've had health departments that all resigned, and it's been challenging in that aspect, where these people are trying to do the best they can with the amount of evidence and guidance that they're getting, and they're trying to do the things that are right to protect the community.
There's been so much misinformation, so much fear, so much unknown in the general public. And sometimes that manifested as anger in those people. And when people are frustrated and they're being told that they have to wear masks or they have to social distance, they have to find somebody to blame. They feel that they can't really blame a virus that they can't see. So they tend to blame people like public health officials who are telling them to do these things or not do these things. And for me, that's been very personal. This is my hometown. This is where I grew up. This is where I was born and raised. And these are the people that I've cared for in my medical practice for the last 11 years. And when they've trusted me for the past decade, and then they start questioning my motivations and my recommendations, it really is hurtful. I've had somebody drive by my house videoing when they saw extra cars in the driveway, trying to say that I was not following my own rules. I was escorted out of a public meeting about mask mandates because the sheriff's department thought that I was in danger. And I've had people call for me to be fired on social media, saying that I was manipulating the commissioners, when of course we've worked as a team. But also, I've worked to advise the county commissioners because they don't have a health background. It's been tough. The county commissioners act as the Board of Health, and they are trying to do their job. But they also at the same time have told me that I focus too much on health and science and not enough on the economics of the town. At one point, they told me that they were going to open up their applications for my position because they didn't agree with what I was saying. And so when that information got out to the general public, I had so many people write letters and show up to the commission meeting to speak on my behalf and say, you know what, we do believe in what she's teaching us. We believe that she is keeping us safe and healthy. And that meant the world to me. I believe there are always more supportive people out there than there are people who are mean or hateful or angry, but those tend to be the louder people. And again, that can be a very personal thing in a situation like this. For all of us in public health, we've learned a lot, and we are going to continue on and continue to help keep people safe because it's the right thing to do.